Good, happy Tuesday evening, November 30th, 2021. I'm Riley King. Welcome to this Tuesday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday evening, so let's get started right now. First up, strike teams planned to help New Hampshire hospitals move patients to nursing homes. Let's take a listen to that video from WMUR News 9.
This holiday season, I recommend a Flavor Yard membership as a great gift for anyone who appreciates fine spirit.
This chart is very, very real, and it doesn't look like it's stopping anytime soon.
Governor Chris Sununu issuing yet another warning about the severity of the current COVID-19 surge. He says he expects cases and hospitalizations to keep going up for at least the next few weeks.
But this is the reality we've been talking about for the last 6 months. People have to take it very seriously. I think they are with the high demand of vaccines. But this is hospitalization. This is hospitalization. What usually follows this, unfortunately, is the fatality rate.
As COVID-19 hospitalizations hit new record highs and continue to rise, the state is announcing a plan to create what it is calling strike teams of healthcare workers brought in from out of state to staff up long-term care facilities.
Composed of nurses, nursing assistants, some paramedicine, some EMTs. There are a handful of facilities that have already reached out and said that they would be willing to reopen admissions, open an empty unit to start taking patients out of hospitals.
The goal is to free up 30 to 50 beds at hospitals for COVID patients by moving out the long-term care patients who are essentially stuck there at the moment. Officials are hoping to add another 30 long-term care beds at existing rehab hospitals.
8 strike teams to open up at least 2 sizable units in facilities, different parts of the state.
Now, it's going to take some time to get these strike teams up and running. American Rescue Plan funds will be used, and that means that the process of requesting and approving the money will have to go through the Executive Council and the Fiscal Committee, so it's going to be weeks before these healthcare boots are on the ground in New Hampshire. Reporting live in Concord tonight, Adam Sexton, WMUR News.
Okay, and there you go on that video and that report. Granite Staters can sign up Wednesday for New Hampshire's one-day COVID-19 vaccine booster push. The state's booster Blitz set for Saturday, December 11th. Let's take a listen to that video from WMUR News 9.
I thought the ringing in my ears would never go away, but then my doctor recommended lipoflavonoid. With 60 years of clinical experience, it's uniquely formulated to help reduce tinnitus. And now, life sounds pretty sweet.
Well, the Department of Health and Human Services has designated 15 locations to provide booster shots during a one-day event. This is actually something we first told you about last week, but we got an update on it today. So on December 11th, about 2 weeks from now, the state will host a booster blitz. Those locations will provide booster shots to any adult 18 and older who wants one. People who sign up will have an option of which booster shot they would like to receive. They can also register appointments for up to 5 people. Now, registration is required. There will be no walk-in appointment. So starting tomorrow morning, New Hampshire residents can log on to vaccines.nh.gov to sign up. 10,000 booster shots are being prepared for this event. But even with the booster blitz, there are still a lot of people who may still be trying to get one since the state vaccinated hundreds of thousands of adults when vaccines first became available.
It's a combination of factors that are causing a big crunch on the system. But understand, we have well over 500,000 people to get their booster. So it's just natural to appreciate that that can't happen overnight. And if people might have to wait 3 days or a week or even a few days more.
Now, as far as calling up the National Guard to deal with this demand in boosters, the governor says utilizing the Guard is still on the table, but he adds that they may be needed in other areas. The governor also says the state may host another booster blitz down the road, but that all depends on demand and vaccine availability. Reporting live in Concord tonight, I'm Tim Callery, WMUR News.
Okay, and there you go on that video and that report. Some New Hampshire schools reinstate mask rules, go remote as COVID-19 cases rise. Let's take a listen to that video from WMUR News 9.
Jen, with each district choosing their own course of action, we're seeing different reactions to these rising cases. Some schools are bringing back masks. Others are closing classroom doors for the time being. Greenland Central students in grades 7 and 8 are remote until December 8th after 2 students tested positive. SAU 47 superintendent is bringing back mandatory masking to the CHS facility after 2 COVID clusters were confirmed. Over in Ware, Central Woods Elementary reports 12 positives since Thanksgiving break. Cases are also up in Merrimack schools. As of yesterday, Interim Chief Education Officer Everett Olson reports 65 new cases. Still, he says students will not return to remote learning.
We don't want to go back there. We don't want children sitting at their countertops or sitting at their dining room tables or kitchen tables at home without connecting with their peers, connecting with our staff. Because as much as school is a learning environment, it's also a very important socialization environment.
Olson says a majority of positive cases in students are not contracted from within the classrooms, but during socialization outside of the building. Reporting live, Grace Feinerman, WMUR News.
Okay, and there you go on that video and that report. New Hampshire Judicial Branch concludes review of judge's decision in domestic violence case. Let's take a listen to that video from WMUR News 9.
The report is 40 pages. The conclusion determined the final hearing and dismissal of the application for protection was conducted with fairness and in accordance with all applicable laws. In short, the judge did nothing wrong.
I think what the report shows is that the legislature intended for restraining orders to be a remedy that is available to victims who go to court on their own. And what has happened over decades is that the courts have, in essence, rewritten the law and added many requirements that make it much more difficult for victims to access this remedy.
The report noted the woman in this case only provided evidence of physical abuse from 2016 and did not provide enough proof to meet the standard of a credible present threat. She was shot 26 days after the final order was dismissed.
I think the judge needs to be held accountable, and she's not going to be.
The victim's mother points to the temporary restraining order granted by the same judge in September, saying it was working. Now, her daughter needs a brain operation.
Her overall mood is okay. She's communicative with her hands and eyes.
The report outlines 7 areas of improvement for the courts that include increasing awareness of Supreme Court opinions in protection order cases and a review of the forms used to apply for protection to clarify legal standards to qualify for court-ordered protection. Live in studio, Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. $100,000 New Hampshire households request free at-home COVID-19 test kits, exhausting the supply. Let's take a listen to that video from WMUR News 9.
They like salt on my skin. I know it sounds super.
Well, the team from the organization running that program called Say Yes COVID Test told us that there are no more tests available to order. In less than 24 hours, 100,000 New Hampshire households signed up to get those free test kits. Well, each home got 4 kits with 2 tests per kit. Now, anyone attempting to order a test online will see a screen telling them that the supply has been exhausted. Now, the governor's office says they're working with federal partners to determine if the possibility of replenishing the supply, but right now there are no more available through the online portal. The rapid antigen tests provide results in 15 minutes and are meant for people who have symptoms of COVID. Dr. Nathaniel Haffer from the University of Massachusetts Chan Medical School, who studies these types of at-home tests, he says that they're pretty accurate.
If you're negative on an antigen test, you can be really pretty confident that that negative result is true. If you're positive, and if you have symptoms, again, you can be pretty certain that you're positive.
And if you do use the at-home test kit and you test positive, health officials are asking you to report it to your primary health care doctor, who will then report it to state officials. Live in the studio, Alyssa Ali, WMUR News.
Okay, and there you go on that video and that report. And that does it for this evening edition of the Riley King Newscast, right here on the Riley King Network. Thank you for tuning in and watching. Have a great rest of your evening, and I'll see you back here tomorrow for another newscast. Good night and goodbye, everyone.